Hey everyone, this is Susan with NRSNG. Today we're going to be working through a care plan on COPD. To see our massive free database of nursing care plans, just visit nrsng.com/nursing care plans. You can also download our free editable PDF care plan template that I'm using at nrsng.com/care plan template. So let's get started. For COPD, the first nursing diagnosis I put is obviously impaired gas exchange. This would be related to their COPD as evidenced by hypoxia. So with COPD, your alveoli are not exchanging well. They're outpouched. You're not pushing the CO2 out as well. You're not receiving the oxygen as well, and it's obstructed. So COPD standing for chronic obstructive pulmonary disorder. So you're not exchanging very well, causing you to be hypoxic. The second nursing diagnosis that I put is ineffective breathing pattern. This would be related to the alveoli dysfunction, and it would be as evidenced by shortness of breath, hypercapnia, the fact that we're going to have a ton of CO2 build up in your lungs and also in your blood. And for some COPD patients, or most COPD patients, the CO2 is what drives their breathing mechanism, whereas it's opposite for us. As normal people, we tend to use the oxygen to drive our neurological breathing mechanisms. For the third nursing diagnosis, I put activity intolerance related to COPD. But this would be as evidenced by their difficulty in breathing, their shortness of breath, their decreased amount of activities. And you're going to notice that people with COPD also tend to do less activities. It doesn't necessarily mean that people that have COPD are overweight, because emphysema patients, are very thin, and emphysema is underneath the umbrella of COPD. They have that barrel round-chested kind of look. So it's not necessarily related, but in general cases, you can assume that the patient is probably going to be overweight. So for our first patient goal, we're going to have them maintain oxygen levels and an effective breathing pattern. We're going to do this by educating on proper oxygen levels. When should they come into the ER? How should they use home O2 if they need O2? Are they going to be using like a nasal cannula or a breathing mask? And then all patients who have COPD should have a home pulse ox. And then also you want to teach them on pursed lip breathing. So if they feel like they are having a really rough time with breathing, teach them. Purse your lips, blow out the candles, slow down your breathing. So yes, we are going to implement this. And then we're going to evaluate it by having them do a verbal read back and a physical demonstration. So have them show you their pursed lip breathing technique. Have them show you they know how to use their pulse ox. Have them give you a verbal read back. Hey, I'm going to come into the ER if I'm not able to catch my breath and I'm not doing anything. So the next patient goal is to reduce factors complicating COPD and their ability to breathe. This is a very large patient goal, or it can be a large patient goal. It usually entails things like quitting smoking, losing weight if they're having a weight issue, avoiding irritants like smoke or pollen, cold air, things like that. Animal fur can be one of them. Getting the flu shot is huge. Making sure they're vaccinated, because you want to reduce the risk that they're going to have a respiratory related issue, and the flu would definitely cause them to have breathing issues. So yes, we are going to implement that. And for evaluation, this can be tough because you want to give them the tools that they need to do things like quitting smoking, but it's really in their hands if they can quit smoking or they can lose weight, and that is really difficult to do. So especially if they've been doing it for years, like smoking for years, quitting smoking can be very difficult for them. So making sure that they're up to date on their vaccines is a great way to evaluate that. Reassess their smoking status with them. Don't beat them up over or make them feel like they're a complete failure because they haven't quit, but continue to encourage them to quit, and then have them give a verbal readback. Why is it important for them to quit smoking? For the third goal, we want to make sure that they are prepared for exacerbations, and the intervention on that would be to educate them on rescue inhalers and nebulizers and how to use them and when to use them. Making sure that they have the medications at home ready to rock and roll. Their scripts are available. They have picked up their scripts. They have the means to pick up their scripts. We're not just talking about like driving to the store or paying for it. I mean, all of the means. Are they able to carry it on them? Are they able to remember? Are they mentally all there to remember to take that? Or do they have a caregiver? Make sure the caregiver is on board. So yes, we're going to implement that. And for evaluation, have the patient demonstrate how they're going to use their nebulizer. If they're going to use a DuoNeb, or if they're just going to have an albuterol nebulizer. And then for their inhaler as well, make sure that they can demonstrate how they're supposed to use it, how they're supposed to make sure how many puffs are left in their inhaler, and that they know how to refill their scripts and when to refill their scripts. And then, like I had said prior, making sure that their prescriptions are available. COPD is a major diagnosis. I see it all the time in the emergency room, and I think we see it quite often in the hospitals as a reason that a patient would be admitted, or patients that are admitted also have COPD. So this is an important one to make sure that we continuously work on the patients with and have a care plan ready and set for them.
Visit nrsng.com/nursing care plans for our huge free care plan database, and nrsng.com/care plan template for our editable care plan template PDF. This has been another episode of the NRSNG podcast. Thank you for joining us, and thanks for being a part of the NRSNG family. Now, go out and be your best self today.